She's a life member of Indian Dietetic Association and Nutrition Society of India, and she has been a founding member of Indian Society of Parental and Enteral Nutrition. She has various publication and book chapters on enteral and cancer and critical care nutrition, and she's been a recipient of Sagar Mal Goenka Award. We welcome you, ma'am, and I hand over the session to you to take it ahead.
Thank you, Vandita. I'll share my slides now.
Yes, ma'am.
Hello, everyone. When it comes to artificial nutrition, we know enteral nutrition is the first line of nutrition therapy. But when there are contraindications to enteral nutrition and when we are not able to meet the nutrient requirements adequately, then the next option is, of course, parenteral nutrition. When there is such a situation, should the patient be started on parenteral nutrition or supplemental parenteral nutrition immediately? What is the deciding factor? Is there a time frame? What are the indications? We are going to hear about this and much more, starting from basics, including definition, types of access, criteria to choose a particular vascular access, initiation, complications, and monitoring from our speakers. This is a recent paper that came out in Journal of Parental and Enteral Nutrition. This asserts the importance of a nutrition support team. They say when supplemental parental nutrition is unrestricted, a high proportion of individuals got inappropriate prescription of PPN. As a result, it led to potential complications and risks. So the PPN or TPN should be managed by a dedicated nutrition support service. When we are on the topic of nutrition support service, I would like to share my experience with nutrition support team and parental nutrition. When I joined my career in the early to mid 1990s, I was fortunate to be part of the first nutritional support team in India. Back then, there were no PN bags, the ready-to-use PN bags, 3-in-1 or 2-in-1 bags as we have now. So when a patient had to go on parenteral nutrition, we had to start from the scratch. Like we had to decide on the stock solutions. We had to help our physician, who was Dr. Krishnan Sriram, in mixing the various macro and micro solution under the laminar flow. But of course, parental nutrition has grown ever since. And today's dietitian's role, which is very pivotal in the nutrition support service, is to identify whether the patient is appropriate to receive parenteral nutrition, be it total parenteral nutrition or supplemental PN. This she does by assessment, which also includes the risk for refeeding syndrome. She calculates, selects the proper formula, monitors, and also helps in the transition from parenteral nutrition to enteral or oral feeding if possible. Now, with this, I would like to invite Roma, who's just a moment, please. I'm not able to see the slide in full. Sorry, Roma, just a moment. Roma is a senior clinical nutritionist in SL Raheja Hospital, which is a Fortis associate in Mumbai. She has 15 years experience in clinical nutrition and has taken part in research and training. She has her master's in food and nutrition and is also a certified diabetes educator. Her main areas of interest are critical care, diabetes, and oncology. She holds a prestigious award of excellence as a diabetes educator 2024 for contribution in improving lives of people with diabetes. She has 3 research papers published in international journals to her credit. She was the former secretary of ISPEN Mumbai chapter and is presently serving as a national executive committee member, ISPEN. She has been a part of organizing team and faculty in various nutrition workshops, including Nutrition Bootcamp and ISPEN National Congress. Welcome you, Roma. Please take over.
Thank you, ma'am, for that introduction. Hello and welcome, everybody. Good afternoon. So my introduction is already given. I'll definitely straight away go to my slide sharing. So are my slides visible?
Yes, ma'am.
Hello?
Yes, ma'am, it is.
Okay. So yes, so what I'm going to talk about is parenteral nutrition, the basics of it, dietitian-led care. And now why is it dietitian-led care? Because I'm dietitian, of course. But as I understand, many a times parenteral nutrition seems a little different, difficult, and challenging. It seems more like writing a medical prescription rather than prescription. But as dietitians, we are responsible for all modalities of nutrition care when it comes to patient. So parenteral nutrition being one of the very, very important modality. So whether it seems like a medicine prescription, we should be knowing what parenteral nutrition is and learn how a dietitian can be an effective part in nutrition planning when it comes to PN and critically ill patients. So we'll understand what parenteral nutrition is. Basically, parenteral nutrition is administration of essential nutrients directly into bloodstream intravenously. Could be centrally or peripherally. That could be through big blood vessels, or it could be through peripheral lines. Initiated with patient cannot get adequate nutrition through oral or enteral route. It can either be only source of nutrition as total parenteral nutrition, or can be used to enhance enteral or oral nutrition via supplementing through PN. Should be initiated if patient is unable to tolerate nutrition for more than 7 days of hospital stay. So the parenteral nutrition formulas are a sterile liquid solution containing essential nutrients tailored to a patient's specific needs. It can be in an individual component form, like carbohydrates are in the form of dextrose or glucose or dextrose, protein as amino acid, fats as lipids, vitamin minerals like calcium, phosphorus, magnesium, sodium, and potassium, and also trace elements like zinc, copper, and selenium. Or this can often be as a sterile emulsion that contains all of it or a couple of it together. So it is categorized basically into two ways. One is total parenteral nutrition and the other is peripheral parenteral nutrition. Now, what we understand by total parenteral nutrition is that when a patient requires all of their nutritional needs via a catheter route, it is called as total parenteral nutrition. And this is basically used for a long-term support, wherein peripheral parenteral nutrition uh, is via intravenous line, which usually is used for short-term period. So here is a pictorial depiction of that. First is central venous catheter, PICC line, and then there is peripheral line. Now, indications for PN. Now, a small disclaimer here. I'm not going to, dive deep into this because our expert, upcoming speaker will talk in detail about this. But yes, where do we, in what cases do we start or we look for parenteral nutrition support? It could be intestinal failure cases. like short bowel syndrome, high output fistulas, chronic intestinal pseudo obstruction. It could be in severe GI bleed where PN allows for bowel rest and avoid further irritation. It could be in cases of persistent vomiting, weight loss, and electrolyte imbalance, critically ill infants and neonates, hypermetabolic states like severe sepsis, trauma, or excessive burns, and contraindication to enteral nutrition where the GI function is compromised and we need to support the nutrition via peripheral line or central line. So supplemental PN is something like how we plan a patient's diet and to meet up the extra requirements which is not being able to fulfilled by orally is to do by enterally. Similarly, in parenteral nutrition, it can be done by topping up with supplemental parenteral nutrition. So if the patient's requirement of calorie and protein is not met efficiently via oral or enteral nutrition, it can be done with complementing it with parenteral nutrition. It is used as a bridge therapy to meet nutritional goals while relying primarily on the GI tract. So this is very important. Supplemental is only when the GI tract is working, but you are not able to meet the full calorie and protein requirement of the patient after a period of time. So the basic difference between supplemental and total is the purpose, delivery, concentration, and duration. Supplements, existing intake from oral or enteral sources, wherein total parenteral nutrition is complete delivery of nutritional support via central catheter. Delivery can be, as I said earlier, it is through peripheral line and it is less concentrated. Here in total parenteral nutrition, it requires a central venous catheter to handle the higher nutrient concentration. Since the concentration is less, so it prevents the damage in peripheral veins in case of supplemental PN, wherein in total parenteral nutrition, because it is total parenteral nutrition, it is highly concentrated. Duration for supplemental is short term, temporary basis, wherein total parenteral nutrition can be long term and sometimes permanent. Now, what is the dietitian's role in parenteral nutrition? So it starts from very basic. First is assessing and assessment. So when a critical patient walks in, gets admitted in ICU, what we first do